This video is so important because what most people don't know, and even some doctors don't know, is that up to 80% of all disc herniations have the capability to heal on their own without surgical intervention if you take the appropriate conservative steps. In addition, at the end of this video, I will show you my top tips for how to safely use an inversion table to help support the body's healing process through disc herniation injuries. Be sure to watch this video all the way till the end because missing any parts could be the reason why your back pain becomes chronic, which can prolong your healing recovery. Okay, let's get started. Your relief could be just a few simple steps away. I'm Dr. Marc Dupuis, a Corrective Care chiropractor in Sanford, Maine. I created this channel to share information on how to improve your posture and spinal alignment so that way you can feel better, move better, perform better, and have overall improved health. Before I dive in, please take a minute to subscribe to this channel so that way you can learn more about how to improve your posture and spinal health so you can move better, feel better, perform better, and have overall improved health. Let's break down the top 4 symptoms of an L5-S1 disc herniation injury. That way you can better understand if this is the true source of your low back pain and leg pain. Number 1, radiating leg pain. This is important. When we're talking about radiating leg pain, we're talking about leg pain that starts in the low back and travels all the way down the leg, often into the foot. And this is more of a sharp electrical type of pain. The type of pain that patients often describe pain like, man, I had a finger in the light socket. That type of electrical shocking type pain is what we're talking about. We're not talking about patchy pain that's in the low back and maybe one part in the knee or one part in the low back. No, we're talking about true radiating pain, which we call radicular symptoms. That's pain that starts in the low back and travels all the way down the leg, often into the foot. Most common symptom number 2, and that's numbness, tingling, either or both. If you have numbness and tingling in an extremity, your leg, and you also have low back pain, that is a good sign that there may be a herniated disc that is causing your symptoms. Most common symptom number 3, muscle weakness, particularly in the legs. If you notice that, boy, when we go to stand on our tippy toes, if one side is stronger than the other, if we're not really able to elevate like we do on the other side, if we're walking and we're feeling what's considered a dropped foot, if you're noticing weakness in the quadriceps or the hamstrings or the glute, muscle weakness is another common sign that now we have a disc herniation injury that is starting to affect the nerve roots coming out of the lower back that travel down the leg. And lastly, most common symptom number 4 is pain with certain types of motion, particularly if we're flexing the lumbar spine, which can put more pressure into the discs, and also if we're twisting, that also can put more pressure into the discs. And the worst combination movement of all is a combination of a forward bend with the rotation. So things like vacuuming, sweeping, raking, if we're bending and flexing and that's creating more pain and especially radiating leg pain, that is a very good symptom. That is very good that increases the likelihood that your pain could be coming from an L5-S1 herniated disc. All right, so if you're still not sure if your symptoms are likely due to an L5-S1 herniated disc, here are a simple self-checks that you can perform to better hone in on if these symptoms are the result of a disc injury. So number 1, we can do some leg muscle checks ourselves. I kind of described this before, but you can literally do a test. You can stand up, go up, raise off of your heels on both feet, and then lean all of your pressure into one side, and then all of the pressure into the other side. If you realize that, man, I can't really hold myself up on the right like I can on the left, or vice versa, then that's a good indication that you have an L5-S1 disc herniation injury. Another simple test that you can do is you can lie down on your back flat. You can raise each leg one at a time. If, when you raise one leg at a time, you start to get radiating symptoms down that leg that you're lifting, that is a very good indicator that there's a strong likelihood that you have a lumbar disc herniation injury. Now, this next part is a very important note. These tests that I describe, although simple and can give you a rough idea if you have a disc herniation or if that's likely causing your symptoms, They are by no means a substitute for professional evaluation. If you have low back pain and radiating leg pain, it's very important that you see a qualified professional, especially a doctor of chiropractic. Now, let's dive in on how do we best try to help someone heal from a disc herniation without drugs or without surgery. So the number one thing you need to do is see a corrective care chiropractor. Why a corrective care chiropractor? Well, simply put, structure determines function. The first thing we have to ask is if there's a problem that developed, if the body's self-healing and the body's self-regulating, why did this problem happen in the first place? Simply put, hey, why did you break? What we found is that in a high number of cases, due to physical stresses, chemical stresses, and emotional stresses, a large number of people over time lose the proper spinal alignment. And this is just basic engineering principles 101. Structure determines function. If we lose the proper structure of the spine, if we lose our posture, if we lose the lumbar curve that we're supposed to have, we're not going to distribute shock the way that we're supposed to. We're not going to be able to move the way the body's designed. That can lead to poor movement patterns and accelerate wear and tear on the tissues, which can ultimately lead to more frequent sprains, strains, and disc herniations. While traditional chiropractic is fantastic at providing relief, if we've lost our structural posture, if we've lost our normal alignment, you can't drug it straight, you can't pill it straight, and traditional care will not change your alignment. That's where corrective care chiropractors come in. We use the most research-supported techniques in the world on changing and rehabilitating the spine to its more proper alignment and position so that it functions better. Number two, when there's an acute disc herniation, there's a lot of low back pain and leg pain, non-surgical axial lengthwise traction can be extraordinarily helpful for these cases. Many cases utilize a table like we have in our clinic. We use the Dynatron DX2 tables. The patient is lying on their back with a bolster under their knees, so it's a very comfortable position. And the table provides 45 seconds of stretch, 15 seconds of relaxation, and that's repeated. We build up to about 15 minutes of treatment time. And what that does is it helps to pump out inflammation in the discs. It helps to draw in fresh blood and nutrients to support the healing process in those discs. And again, this is so important because a lot of doctors, a lot of surgeons won't tell you this, but up to 80% of all disc herniations can heal on their own if you take these conservative steps first. Now, that doesn't mean that 100% of disc herniations will heal. Yes, we do send some people out for surgery, but a lot more we take care of naturally by supporting the healing process. Now for some bonus content. I want to address something that gets asked of me all the time. Patients will often ask, hey, what about inversion tables? What do you think? So here are my top tips for how to safely use an inversion table. Inversion tables can be helpful because you can get a little bit of distraction, a little bit of gentle stretch in the spine to take some pressure off of those bulged or herniated discs. These are my top suggestions. Number one, you have to have a table where you can control how much inversion you're getting. Never, ever, ever do we want to go full inversion. You might think you're relaxed, but that's just too much force on the spine. A lot of times you'll have contraction of internal spinal stabilizers, which can make the problem worse. Also, that's a lot of pressure on the blood vessels and the vasculature of the body, especially if you're not used to inverting. So never do we go full inversion. I like about 45 degrees or so. That seems to be enough inversion just to get some distraction to take some pressure off the spine without interfering with the healing process or making things worse. Now next, those tables, the table that you're using, you have to make sure that there's a safe way that you can get yourself up. You don't want to get yourself onto a table where you have to get into an awkward position to get off of that table because you could get injured and that would also make the problem much worse. So make sure you have a table where you can control how much inversion do we shoot for, probably around 45 degrees, and then how much time. This is another important thing. Of course, the standard American way is more is better, but that is not the case here. Your spine is designed to balance against gravity, so we don't want to do too much time on the inversion table. Typically 5 to 10 minutes max, but you can do that every hour or so if needed. I've seen many cases where people said 5 minutes felt good, so I'm going to lie on there for 20 minutes, and then they can almost sprain their tissues by creating too much stretch. So there you have it. Limit that usage 5 to 10 minutes at the most each session, but you can do that every hour, especially if there's an acute hot disc herniation. So now you should have some basic information to know if your symptoms are likely caused by an L5-S1 disc herniation, and if so, what are some of the simple steps you can do to support the natural healing process starting now? If you have comments, questions, if there are topics that you would like us to cover in the future, please leave comments in the space below. And be sure to subscribe to this channel so that way you can learn more tips and strategies on improving your spinal health and posture so you can feel better, move better, perform better, and have overall better health.